Hayward. I'm with the Accord Network. Accord Network is an association of Christian relief and development groups. We focus on leadership and especially standards of excellence for our members. All of our members are in the U.S. working internationally. We are members of CCIH, and CCIH is actually members of Accord Network also. And I'm excited to be able to put this session in your hands here and to be able to introduce our next speakers. It's been great to talk to them briefly before this time too. We have Dean Pallant from Pallant, I'm saying it wrong already, he already told me what to do here, from the Salvation Army, based out of London. Daniel Reeves from Open Bible Standard Churches, and Latasha Ogunlana from Glen Nyami Consulting. Did I say that right? Okay, thank you. And with that, I'll turn it over to them. Our time is short. We want to be good to your time because there's a break coming up here in just over an hour. And at the end, we hope to have a few minutes for questions and answer. But for now, let me turn this over to Dean.
Good afternoon. Just for any of you who are not maybe first language speakers, or you'd prefer to have the notes, I have some of my notes here, so if you wanted to collect those, you're welcome to. I know sometimes it's challenging when you're working across languages to track everything, and it might be easier just to see what I'm saying. My paper this afternoon engages with the question that has been set before CCIH 2012. How can Christian organizations working in developing countries influence national government policies as they relate, I haven't even have it up on a slide there, as it relates to health inequities, gender issues, and other challenges. The key word that I'd like us to look at in my paper is the word influence. Influence. It can be understood as simply advocacy. How do we get them to do what we think they should do? Or it could be taken a bit more in depth. And I'd like to suggest that that's the way to go this afternoon. Because influence is much more complicated and cross-cutting than that. It's more a question of who influences who, with what, and to what end. If we're encouraged to partner, particularly as faith-based organizations, it's incredibly important that we understand the power of influence, both how we can influence others and how they influence us. So how can our influence be a positive, kingdom-enhancing activity, and how can we mitigate against the negative influences? My paper is not simply reviewing techniques, tools, or interventions that shape behavior, but rather I unashamedly promote a faith-based way of working. In social science, technical speak, reflective practice. How do we define and promote a more reflective way of living faithfully in this world? At the heart of the issue I want to argue this afternoon is the importance for faith-based organizations and other groups having the space and the capacity to promote their particular understanding of what it means to be healthy. First, a few words of introduction. I'll just put that up. My wife, Irene, and I, who you've probably seen around, we've been the International Health Services coordinators for the Salvation Army now for the last 5 years. And we were tasked in 2007 with reviewing our health ministry around the world and coming up with a strategy for our hospitals, clinics, congregations, and community-based work in more than 120 countries around the world. And we've had this amazing experience over the last 5 years of traveling extensively and seeing the amazing work that is done by the Salvation Army and our partner agencies. And part of what that reflection did was enable me to write a doctoral thesis, and I've just published a book, which there are copies of available today, remarkably, for $20. Keeping faith in faith-based organizations. I am a practical theologian, and I was interested to look at the biographies today and realize I think there's only one or perhaps two other people here who have doctorates in theology. And I think that's interesting for the Christian coordination, for CCIH, which is unashamedly Christian. But I wish there were more practical theologians here, because I do think that practical theology offers some tools that will be really helpful to those who are trying to make the world healthier and more faithful. Irene is a medical doctor, and she has works in primary healthcare in the UK, and we have found that bringing theology and the sciences together is a very natural fit, as we heard earlier today. They belong together. And this is a countercultural message still in many parts of the world, particularly Europe, where we work. There is still a strong belief that it is better to keep faith out of things rather than bring faith into things. And so I think if we're going to engage in this discussion, we need to be aware of the opposition, but also strongly committed to the difference that faith-based work makes. And central to what we propose as we travel around the world is what we call a faith-based facilitation process. Now, those of you trained in the social sciences will be very well aware of facilitation. How do we get people to work with us? How do we listen to groups? How do we engage in a community, collaborative way of working? And all of that is absolutely excellent. But as we looked at best practice within our own organization, we realized that the people who did it really well brought their faith into it as well. They were able to not only identify issues, not only describe and analyze them with all the tools that social science and the natural sciences provide, but they were also able to bring the Bible, their faith tradition, and central to this, the spirit, the kairos moment, God's moment, the moment that the aha moment. And by bringing those things all together, when decisions are made, they are made in a much more comprehensive, a thick way of working. And the action that comes out of it is much more comprehensive and holistic. And then, of course, the cycle goes on. You will be very well aware of the cyclical approach. But the distinctive that I think FBOs bring is this Bible and faith tradition. So I'd like to use that model this afternoon to quickly talk through some of the issues that we face as the Salvation Army in building partnerships. So step 2, as we now sort of describe and analyze the challenges that we face in trying to help the world's poorest people have a better health. Because that's our shared concern. Whether you're from a Christian, Muslim, Buddhist, Hindu, secularist approach, you still want the poorest people to have a better health approach. So what are some of those issues that we face? I'm going to be very, very brief, I'm afraid, just because of time. But the first point to say is that we have to be aware of the influence of the state, of the government. And in some countries, as we've traveled, we've seen that the government health policy is incredibly prescriptive and sets standards that have to be followed. Zambia, where we worked for 4 years, is a good example. We have to work absolutely in step with the Ministry of Health, and that's generally a positive partnership with the Christian Health Association of Zambia and the many other similar organizations that are there across Africa. But it still requires us to be very intentional about keeping faith in our mission hospitals and not allowing them just to become servants of the state. It's not the politicians who are in charge. That's not the agenda that we seek to follow. But of course, in English we say, he who pays the piper calls the tune. And sometimes because the money is coming, we know we are shaped by them. In the book I talk about the social science concept of institutional isomorphism, which means we are shaped and morphed into the most powerful forces that are around us. And in many countries I fear that the state is very powerful. Second influence that is significant is that of the market. And again, as we've traveled, we've seen this in particularly in India, Indonesia, very powerful forces of a commodification of healthcare. If you can afford it, you can have it. But this brings different challenges to the Salvation Army. We find many of our organizations, many of our hospitals, wanting to get the most profitable patients, wanting to do the most profitable interventions, and not, as we were saying this morning, necessarily the relational ones. How do we make money out of this? And that is a very powerful market force that shapes us. Next influence that we've identified is that comes from our other NGO partners. And sometimes the work there, telos, the Greek word of your overall goal, we have to say that although we share a concern with people, that is not the same as saying we have the same goal. We do not have the same goal as the Red Cross, the Salvation Army. We have a different goal. We are intentionally a Christian organization. So we understand what it means to be a healthy person, a developed person, different to how, say, the Red Cross would see it. So we are aware of an alternative telos, but that doesn't mean that we can't partner with them. So we're willing to partner because we share the concern, but that does not mean that we have exactly the same understanding of the goal. The fourth and final pressure that we've identified is that of congregations and clergy. It's not just the humanists and the secularists who create tensions. Sometimes the issues are closer to home. And many hospital worker has said to us that it would be easier if they didn't have to deal with the clergy and the congregations. And in our session earlier, we were really promoting a congregational way of working, and we still do. But we're not unaware that that brings tensions. And we do have to say to the congregation and the clergy, we do share the same telos. We do understand what God is wanting people to be. How are we going to work together to achieve that goal? But it would be naive to suggest that there aren't pressures that come from that. So what we've been doing in step 2 is trying to describe and analyze the situation. In step 3, I just want to briefly say, how would we bring our theology to that? How would we bring the Bible and the tradition to that? Because many of the process models that we work with do not have this intentional, tradition-specific step that brings the Bible and says, what does my faith have to say about this? A couple of quick ideas. Narrative theology really helps us with an understanding of creation, fall, and redemption. The doctrine of what we were made to be. Who do you think you are? Really useful question to get people discussing. What does it look like to be healthy? The first question to say is, well, what did God create us to be? And in line with the Orthodox Christian doctrine, we believe that people are created in the image of the triune God, the God of relationships, and therefore every person deserves equality without discrimination. But we also live in a fallen world, and so we need a doctrine of salvation, or in a more perhaps palatable way, how do you think you get better? Really important question to ask your partners. How do you think you get better? What is your remedy? And too many times, we're being encouraged to have some sort of creation of people as autonomous, rational individuals. That's not what God created them to be. But sometimes I fear in many of our programs, we are promoting that sort of understanding of what it is to be a healthy person, or how do you get better? And from a Salvation Army point of view, out of the Wesleyan tradition, the doctrine of sanctification is really important to us. How do you live well? What does that look like? And we had a very, very interesting discussion on that this morning, didn't we? How do we live well? And we believe that the Holy Spirit plays a central role in helping people to live well as individuals, yes, but also within creation, within congregations, apologies. So, step 3, we now have some theology to feed into our understanding that we would want to share with our partners. So then we have to come to positions of decide and plan. And we do have to talk to our partners. What do you think is the telos? What do you think is the goal? What is a healthy person? What is that outcome of this program going to look like? We do need to accept that we will build partnerships with people who have a different telos. And part of what I plead for in the book is that all around the challenge of improving the health of the poorest people, we accept the need for a different telos, and we accept the space that is required there. We shouldn't be scared of difference. We should embrace it without losing our own distinctives. Third thing, I think we need a reflective practice as a habitual part of our work. We need to pause and reflect and analyze where we are.